Participant lines muted.
So, Oren, I'll turn the presentation over to you. Thank you again so much for joining us.
Oh, my pleasure. And usually I do this presentation when I see people versus a computer screen. So it's a little less interesting probably for everybody, but this way I can probably speak to more people than sometimes the three I do get at our education sessions. So thank you everybody for letting me into your computer and your phones to talk about something which I think is important, probably also because it helps me pay my mortgage, but also because there's a lot that I think information we can share. So I'm going to go through a bit of background information, and a lot of you, even though a lot of my slides say breast cancer, but a lot of the treatments and side effects relate to people with any type of cancer, and a lot of you know the cancer treatments better than I do, but I go through that for a reason, and one of the reasons is I don't think everybody gets the same information, even at the same cancer center from the same physician. And
Sorry, Oren, I'm just going to interrupt you. Can you speak just a little bit louder? We're having a hard time hearing through the phone.
That's better?
That's much better.
Okay.
Sorry, keep going.
Yep. Thank you for letting me know. So I'm going to go through some of the treatments just to make sure that everybody starts at the same page, but also afterwards when I talk about exercise, it relates to the treatments and some of the side effects associated with treatment. I'll talk a bit about exercising safely, because if somebody exercises and hurts themselves, they most likely won't exercise again. Common questions I get are fatigue and lymphedema and how that fits with exercise, so I'll talk about that, and some ideas where anybody can start and ideas for resources. And when I get to that, I'll talk about that. And like I said, I'm not going to go into many details here. For anybody who had that type of surgery, they hopefully know what they had, even though I've had some people who I work with who did not want to know what they have, which is fine too. But if somebody, for example, has breast cancer, they have different type of surgeries that they can have. Sometimes it starts with a biopsy, progresses to lumpectomy. It may or may not stop there. There may be partial or segmental mastectomy when part of the breast is removed. They have different names for mastectomies, simple, modified, or radical. And that's really what I want to talk about surgery in terms of different types. Of course, this could be one side, two sides, but really surgery, no matter how you look at it, even the smallest ones can have some side effects related to that. Of course, it relates to just having the skin cut, etc. Chemotherapy is a treatment as well, and I'll talk about that. I usually don't mention chemotherapy drugs because every person has their own specifically unique drugs that they may be on, and by the time we really know about one drug, they have new drugs coming out. So really, I don't usually mention about drugs unless I talk to somebody specific, but I'll talk about some of the side effects and how exercise relates to that. Hormone therapy. I've had many patients on hormone therapy, and nobody talked to them at all about side effects, and there are side effects. And of course, radiation therapy as well. Now, regardless of the cancer type, many people have surgery, chemo, and radiation. Men with prostate cancer, of course, can have hormone therapy as well. So some important things: not all women will have all the side effects. So I'm going to go through side effects, but everybody will be different. And not everybody will have the side effects. So it's really important to know that any list, it's just like somebody taking Tylenol. If you look at the list of side effects, it's really, really long. So not everybody will have side effects, and not everybody will have the same side effects. So everybody is unique. It is important that side effects are reported to the doctors, nurses, physios, or whomever you work with, because for many of the side effects you can get help. I've had a person who had some side effects related to breast cancer, and she saw her doctor a week or so before we met, and she didn't have another appointment for 6 months. And she didn't want to bother them because they're always busy at clinics, and everybody knows that. But I said, that's what they're there for. There's no reason to suffer for a long time. If you have something, let them know, call the nurse, and that's how they can help you. So, for example, surgery, less for the biopsies and the lumpectomy, unless it's a biopsy of the lymph nodes. Stiff arm is normal. There may be sensation changes related to when they move muscle, move fat, move nerves. Swelling is normal. Swelling after surgery doesn't mean it's lymphedema. It's normal to have swelling after any type of surgery. Of course, lymphedema is part of the side effects of having breast cancer treatment, but also head and neck cancers and prostate cancers often may have problems related to lymphedema, and I'll talk a bit about that more. Emotional ups and downs. Usually surgery happens relatively quick after diagnosis. There'll be ups and downs related to body change, related to treatments, related to diagnosis. So that is important to know, and there is help out there for that. And I mentioned some physical changes as well. So some helpful strategies after surgery. There's lots of evidence that starting to exercise right after surgery is good. Now, it doesn't mean somebody has surgery and they go right away to exercise. If there's still drains in, for example, exercise can wait a bit. You may not exercise the shoulder, but there's still the elbow and the hand that can do some exercises. So really getting up and walking around is an exercise. We just need to modify exercises right after surgery. When things heal, when the incisions heal, then starting more exercise after that is beneficial. Right after surgery, using soft, light soft bras, breast replacements. I went to a talk not too long ago about different prostheses after having a mastectomy, and it's really a science for itself now, and there's many different options out there. I think in my opinion, it's really important to discuss reconstruction before any surgery. Depends where you are in the province, and different provinces, different hospitals do things differently. So I think it's really important to have a lot of information before you decide on whatever treatment you decide to choose following surgery. And that's where there's help, talking to other people who went through similar cases. One thing I caution about is just searching the net and checking out people's blogs, because really everybody's unique, and generally speaking, checking out blogs is good, and it's a way for sharing information, but it's not always evidence-based, as we call information. So if you're trying to decide on type of surgery or a specific treatment, really talking to the doctors, asking for direction to web pages. Usually those associated with hospitals or universities are relatively reliable. Chemotherapy, there's many side effects related to that. Could be mouth sores, nausea, vomiting, hair loss, fatigue, problems with sleep, temporary or permanent menopause, depending on the treatment, hot flashes, low blood counts, and I'll talk about low blood counts a bit later as well, and many other side effects. Now, it is important, even though there's many side effects, chemotherapy is a very important treatment. So by no means saying too many side effects, treatment is not a good idea. Treatment is a very good idea, but we need to know about the side effects, because once you tell the team for many of the side effects, they can help. Of course, there's medications that can help, for example, nausea and vomiting. However, if you don't ask for help, nobody can help you. I know many of my patients, they just want to tough it out, which is fine and great. Many people do not like taking more medications. They feel that the chemo is enough, but if it helps with sleep, if it helps with eating, it may be something worth considering. Many people after chemo, depends on the chemo, between a few days and a couple weeks, they're really, many people have reduced energy, so energy management, fatigue until counts come up, and then most people feel better. Again, that depends on the chemo as well. Nutrition, of course, as able, everybody has different experiences, but really, exercise is great, but if there's no nutrition in the body, it won't work, similar to other things. So really, exercise and nutrition go hand in hand. Now, if somebody exercises on the last bullet there, and they really work hard, and then they're wiped for the rest of the day, so that's really not good balance. But balancing the exercises with what you want to achieve throughout the day is really what we're after, trying to find that balance. And really, I'm talking here exercise during treatment as well. So, and I'll talk about the evidence a bit later, but there is evidence to show that you can, or this is all statistics, of course, so it's the majority of people or high percentage of people can exercise during treatment. Some can't for many reasons, for many good reasons, but many can benefit from exercising during treatment. The benefits may not be that there's improvement, but for many people it helps with sleep, it helps with quality of life, and it can help reduce some weakness. Talking about hormone therapy and side effects, and this is where I said many of my patients and participants were told that they do not have or were not told about side effects related to hormone therapy. And as you can see on this slide, there are many side effects that could happen. So it's important to know that they're there. Again, asking the team for help, and exercise can definitely help with things like weakness, fatigue. There's some evidence for hot flashes, nausea and vomiting, and I'll talk about that shortly. So again, really important. We can't help our team, or the healthcare team can't help if we don't know. Again, of course, then it's again more medications, but we can help. Really important to know if there's abnormal, for example, vaginal bleeding or discharge because of hormone therapy. Many women have bone and joint pains, and I'll talk about differentiating between what my participants call good pain or bad pains. So some pain may be okay, some not, but it's really, there is evidence that women with bone pain or joint pain can benefit from exercises and some physiotherapy to reduce that. Radiation therapy side effects. Many of my participants weren't informed that radiation can cause fatigue. So they were told, well, radiation, we're just radiating one part of your body, the rest of the body isn't really affected. But in reality, when the goal of radiation is to kill the bad cells, but then whatever's killed needs to be cleaned up from the body, and that's where that body needs energy to clean up the dead cells, and that's where people get fatigue. It is an inflammation of that area, and the body needs to deal with that. There's risk for what's called a sunburn or reverse sunburn when it happens a while a while later, swelling, heaviness, if there are areas that have been radiated, if heartburn, swallowing problems, if the esophagus was in the radiation field. So there are important side effects to know about. Lymphedema is also a side effect of radiation. So if somebody had radiation without surgery, for example, and the lymph nodes were in the radiation field, which often the person is at risk for having lymphedema. So these are just some strategies for dealing with some radiation-specific side effects. Exercise can be done. So if somebody's having radiation, usually the area that's radiated, the doctors may not want us to exercise while the person is on radiation because the skin may be, and the tissues under may be fragile, but there is the rest of the body, right? So if somebody's getting radiation on the right, they can still exercise the left and their legs, for example. So that's one thing we had to educate our doctors about, that just don't ask the person not to exercise, because then it's really hard to get back into that. But ask them not to exercise the area that's been radiated. How long after radiation somebody should let that area rest? That's really something where each person is specific, may need specific instructions because it depends on their dosages, how many radiation they had. So that's where really needing to ask the radiation oncologist, the person who's prescribing the radiation, how long the skin and the tissue needs to relax before or heal before you go back to exercising that specific area. So this is a table that I use when I educate other healthcare professionals as well. And the goal of this table is just really to do a quick comparison. What are the effects of exercises versus the effects of chemotherapy? Now, even though I'm a physiotherapist and I teach about exercise, and I think exercises is great, it's not a magic. So if you look at the first two lines, exercise really has no effect on tumor size or metastases. On the other side, it's also important to remember there's no evidence to show that exercises causes metastases, which is a common question I get as well. So metastases will follow their own course. Metastases, I mean cancer spreading from where it started to the rest of the other places in the body. There is no evidence to show that exercise has a negative effect in terms of making cancer spread. Pain, there is a lot of evidence that exercises reduces pain if done properly. It definitely does not increase cancer-related pain. There is evidence that it actually reduces cancer pain. Similar for nausea and vomiting, exercising helps move food through the digestive system, helps with circulation, helps with digestion. Of course, just like anytime if you have a meal, we don't necessarily recommend you go do a hard workout afterwards. But there is evidence that people with cancer who are in treatment and have nausea and vomiting have less of it when they exercise. In quality of life, what I mean is, just able to do what you want to do. And generally speaking, people who exercise have improved in quality of life. Now, this blood counts is really what I find more exciting, and the reason is this is more an objective measure in measuring the effects of exercise. So, for example, people who had chemotherapy or stem cell transplants who exercise, and it's normal after those procedures to have really low blood counts. Those who exercise recover their counts quicker. Now, it is important for this slide and for a few slides following to understand these are the majority. So when somebody reports a study, it's the majority of people in those studies, or these results are from a combination of systematic reviews, which is take the summary of many different studies and then summarize them in a high-quality way, and these benefits were shown. but it's not a guarantee. So that's really what I'm trying to explain. Even though there's all these improvements, it doesn't guarantee. So, for example, bone mass density, exercising improves bone density, and that's true for anybody, male, female, cancer or no cancer. Exercise is important for bone health. But again, that's the majority. Cardiac or heart function, it improves a lot. Similar for people who had heart attacks. A lot of them go to what's called cardiac rehab because we know exercise improves how the heart works. Now, the next three are bolded, and I'll get back to them a bit later. Again, there is evidence for those who exercise, they have a lower chance of developing some type of cancers, such as breast cancer and colon cancer. That evidence doesn't exist for people, for example, developing rectal cancer or pancreatic cancers, but there is evidence to show those who exercise are less likely to develop some types of cancers. Similarly, there's evidence to show those who exercise may have improved survival for some types of cancers and reduced recurrence. So again, I think it's important to understand these are summaries of many studies, and I'll give a couple examples shortly, but it's not a guarantee. So I've had, unfortunately, many people who did everything they could do right, and still things didn't go the way we wanted them to go. And unfortunately, that sometimes happens as well. In terms of fatigue, lots of evidence that exercises reduces fatigue. And a lot of the people I work with say, really, no, it sounds good, but I'm too tired to exercise. And I hear that a lot when I work with a patient in the hospital. So often what I ask them, okay, that's fair. Cancer treatment and cancer itself can cause fatigue. What did you do for the last day or two? They say, well, I lay in bed. And I ask, do you feel any better? And they say, no. So I say, well, let's try something different right now. Let's try exercising. And often I try to get a little smile out of them, and then we try something different, and they do feel better after they did something. So exercise can help fatigue. It needs to be done properly, and it needs to be done, of course, with nutrition as well. And hopefully all of us know that people who exercise have, generally speaking, better function, improved strength. The goal is not to be bodybuilders, but the goal is to get stronger. And hopefully we all know that, generally speaking, because adrenaline rushes, etc., many people who exercise, their mood is better, and often their sleep is improved as well. So in the next three slides, what I've done is a common question I get, okay, what exercise should I do? And here, in the next three slides, I summarized types of exercise and the benefits from that type of exercise on different toxicities, which means side effects of chemotherapy, and what are the benefits. So, for example, on the first line, if we're looking at the immune system, often chemotherapy suppresses the immune. People are at a higher risk of infection. There is evidence that moderate aerobic, and I'll explain moderate again a bit later, can help with the immune system recovering. Also, an important point is that there's no negative effect. So, for example, there's a few studies that showed sometimes if a person does after chemotherapy higher level of exercise, there'll actually, again, be a bit of an immune suppression before the immune system recovers. So there's a worry that during that short time of immune suppression that the patients are at more risk. But based on the studies that we reviewed, there really is no evidence of a negative effect from moderate aerobic exercise. In terms of cardiovascular, so heart and circulation, there's evidence to show that aerobic, So aerobic is, for example, cycling, treadmill, things like that. And resistance, lifting weights, help with the heart and circulation. So general circulation, it helps with heart function, and it's circulation to the heart as well. So we have circulation to the body and circulation to the heart. So the heart has its own nutrition as well. Pulmonary, so lungs, it's been shown that aerobic exercise is better for lung efficiency, lung volume, and releasing of a substance called epinephrine, and that is one of those things suggested that helps reducing pain in the body. Gastrointestinal, so of course our GI tract, aerobic exercise improves how the time between end to end in the mouth, out the other part, and that's assumed to be one of the reasons how exercise can help reduce the risk for developing colon cancer is food and toxins or whatever we eat doesn't stay too long in the GI tract and gets cleared out through the system. Musculoskeletal, so bones and muscles, again, it's been shown that both aerobic and resistance exercises are needed for bone density, so that's mostly weight-bearing exercises when we're on our legs. For example, swimming is a great aerobic exercise, but it's not really good for bone health. And if somebody has low counts, they shouldn't be swimming anyway. But I'll talk about that in my safety slides. But really, aerobic and resistance are needed. And if somebody wants to reduce weight or fat, aerobic and resistance is needed. Now, it's important to know when somebody exercises, they may not actually reduce weight. Hopefully, they convert whatever weight they have from fat to lean body mass, which is healthy weight. So that's really what we're after, not always necessarily weight reduction. The nerve system or the endocrine system in the body, again, aerobic and resistance exercises have been shown to be helpful, especially things like improved insulin sensitivity and increased glucose uptake. So what that means is our body is able to control the sugar levels better. And that is, again, one of the ways it's assumed that exercise can help with the cancer prevention and reduced recurrence by controlling sugars. Also, it's been shown that aerobic exercises reduces systemic inflammation, and I left those names in just in case you want to look them up in your free time on the internet. But the idea is a lot of these different words or names or different proteins in the body, they're markers of what's called systemic inflammation throughout the body, and they tend to be higher with people who have some types of cancer, and exercise has been shown to help reduce these markers. And again, I mentioned that I am biased towards exercise, but it's not a magic bullet. It doesn't help with if people have liver or kidney-related problems. At this point, there is no evidence that exercise can be beneficial. So these are just a summary of what some of the benefits where we have evidence to show that exercise can help. So reduce nausea, duration of neutropenia and thrombocytopenia, that's the counts, reduce immune and clotting, and I'll talk about that. So quicker recovery of the blood counts, reduced fatigue, emotional distress, improved quality of life, strength. VO2 is endurance. So exercise can help increase endurance, walking tolerance, and improve health, sleep. So really many, many benefits. At this point, there's good evidence, or at least there's no evidence to show that if done properly, that exercise is dangerous. Now, again, I'm going to talk about safety. It's really important that everybody understands that they're unique and they need to know what they have before they can go out and exercise. So in this table, I summarized a whole bunch of different articles and what they showed to be successful in their own studies. Excuse me. So, for example, aerobic exercise, there's studies that show that 2 times a week is beneficial, and there's studies that show that 7 times a week is beneficial. So really, the range is there. If you look at the Canadian guide for exercise, I believe it says 5 times a week. I'm going to talk a bit about heart rate max soon, but 60 to 85% is considered moderate exercise. So the important part here is to understand that the goal needs to be exercise. Going out for a walk to the next door coffee shop is great. It's activity, but it's not necessarily exercise unless the heart rate goes up to a certain level, and it takes about 10 to 30 minutes to get there. So it needs to be a far away coffee shop and walking a little faster if possible. What type of exercise? There is no right type of exercise. The right type of exercise is the exercise that's being done. And if somebody tries to do an exercise they do not like, most likely they won't continue with it. I have very few people who do regularly exercises they don't like. So, if the right exercise is dancing, that's fine. If it's whatever it is, as long as it's, of course, safe, but something that you enjoy to do. In terms of strength exercise, lifting weights and stuff like that, you don't necessarily need to go to the gym and pump iron with all the bodybuilders, but working the muscles 2 to 3 times a week at certain levels, and I'll explain a bit more about that in a moment. 2 to 4 sets of 6 to 12 repetitions, and really whatever works. So if it's a weight machine in the basement or in the gym, that's fine too. Free weights if you can. TheraBands, those are the elastic bands you can buy, whatever the brand is. If you're doing 30 repetitions and you're not really tired, after that you're probably at a weight that's too light. So some of the guidelines we use for our participants is we ask them to start at a really low weight and build up. So do 2 sets of 12, for example, 2 pounds if it's easy, and the next time, not the same day, the next time, you can increase the weight by a pound and then try the same thing up until where you can do 2 repetitions or 2 sets anywhere between 6 to 12 twice. And then when it gets easy, then you increase the weight. If it doesn't get easy, or if it's really hard, reduce the weight. And that's some of the guidelines that we use with our participants in our different programs. Now, it is important to know there's actually evidence to show that relaxation should be considered an exercise as well, and there's some evidence to support the importance of relaxation. So how do you know how hard are you working? What's the right level? In terms of evidence, at this point, there's evidence for moderate to high moderate or high intensity exercises. There is no evidence to exercising at the level of Lance Armstrong that is considered safe, and also considering balance of risk for injury related to exercise versus the benefits. So generally speaking, we use different things to teach people how to decide what exercise intensity to work at. So this is an example, calculating a percent of maximum heart rate, a common way to do that, or easier way. There's way more complicated formulas, but an easier way is the heart rate max, or the maximum you should exercise is 220 minus the age. So whatever number you get, you really shouldn't exercise at the level higher than that number if you measure your heart rate. And then you work at a certain percentage of that. So if you looked at the previous slide, once you calculated your percentages, so if you look at aerobics, so working at 60 to 85%. So that's a goal. Many people won't be able to start there. So you can start at 30% and then increase as you're able. If somebody's on medication that control the heart rate, or pacemakers, or very low heart function related to cancer treatment, or related to other problems as well, not related to cancer, so then this technique may not work. Sorry, it's kind of hard when nobody's asking questions in the middle. Another way to decide what intensity of exercise is called the rate of perceived exertions, or Borg's rate of perceived exertion, which is on the previous slide at the side, and you'll have these slides afterwards. You can look at that as well. So the question is, how hard are you working? And we're after 4 to 6 moderate exercise, moderate activity levels. If somebody works really, really hard, 7 to 8 or 9, they're at a higher risk for injury. So we need to balance, again, the benefits of exercise versus the risk for injury from the exercises. So there is no right scale to use. It's whatever you feel more comfortable. Different gyms have different scales hanging on their walls. There's many different scales. These two scales, this one and the green one on the previous slide, are both easily found on the internet as well. Another thing to measure exercise intensity is called a MET, or metabolic equivalent task. So that really means how much energy and oxygen you burn at rest. And then the higher METs, it's how much, again, it's the more oxygen and energy you burn compared to rest. So 4 METs means you're working 4 times harder than you would be at rest. And again, you can find MET tables on the internet. It's just a way to use a common language between different people, different exercising facilities, different exercise research on how hard people are working. So for example, to lose weight, there's some evidence that says that you need to be working at 4 to 6 METs, so 4 to 6 times harder than what you work at rest. And this is individualized because everybody's different. So I'm not going to read the next 2 slides, but I just provided you with some examples of different MET values. So if somebody's walking slowly to the coffee shop, they're using 2 to 3 METs, different levels as well. So you have this just as a reference for you. And again, you can find these on the internet. Now, I'll just point out the last one, MET 6 to 7 METs, hiking. So here you're actually working hard. Slow jogging is 6 METs. So here you're out, unless you're running to the coffee shop. And the reason I mentioned coffee, life for me cannot really happen too well without coffee. But it's exercise. What I'm after is explaining that you need exercise. Talking a bit about exercise safely, and there was a question I got through the chat thing. Will I provide references for the blood count? So these are the blood counts that we use, and there's a reference at the bottom. It is important to know that every hospital uses different blood count levels for what's right and wrong. This is probably the best one that we know that has been published. It doesn't mean it's the most right one, but this is what's been published, so this is what we educate. Now, if somebody is not on treatment, they may not know what their counts are. So if somebody has low red blood counts, so where I work it's less than 80, they may need a blood transfusion. But if somebody's not on treatment, they may not know that. So how would you know that your blood counts are low? Is if one day you're really feeling, or for the last while, you're able to do what you want to do, and today you're just more fatigued than usual. It's a new fatigue. It wasn't there yesterday. Going up the stairs is harder than it was yesterday. It doesn't mean that necessarily that your red blood count is lower, but it may be worth going to the doctor and asking to check it out, because that's something that could cause that. Risk of bleeding, that's if the platelets are responsible to make sure if we cut ourselves that there's a clot and we don't bleed forever. So if they're less than 50, and again, different hospitals, different areas use different numbers. So somebody's at a higher risk for bleeding, and then we modify our exercises. Again, in the community, you may not know that, so a good hint that this may be, and it may be warrant a visit to the doctor, and not necessarily the cancer doctor, maybe the family doctor, is, if now there's more bleeding from the gums, that's harder to control, more nosebleeds, more bruising, where, you just walk by the counter and you have a bruise without even touching it. So things like that may indicate that the platelets are low, and it may be worth getting checked out. Low white blood cells, that's the worry here, is an increased risk of infection, and there is no really way to know if it's low or not in the community. It could be maybe you pick up every bug in town and beyond, and more infections maybe. But usually people who are on chemo or followed regularly for blood work will know this. If you do know that, it's important to know that then you shouldn't really go out to a community gym or a pool because of the risk of infection if the low white cell count, the cells that fight infections, are low. Of course, if somebody has a fever of 38 or higher, I don't know what it means in Fahrenheit. I'm a Celsius type of guy. If it's higher than that, exercise really shouldn't take place because the body needs all its energy to fight whatever is causing the fever. Now, I mentioned earlier exercise is safe and can help reduce nausea and vomiting, but not if it's severe. If somebody is having severe nausea and vomiting, they're most likely dehydrated and they lack some nutrients, so really that needs to be dealt with first before initiating an exercise program. Now, if somebody has shortness of breath, it's normal depending on the type of cancers or type of treatments, but really shortness of breath at rest is not something where exercise can help, except if somebody has lung cancer. So then it's a bit different, and that's a unique case. But if the shortness of breath wasn't there a day before, and now there is really shortness of breath at rest, it's worthy of being checked out. If there's new bone pain or any pain that really doesn't go away, and I'll talk a bit more about pain shortly, then it should be checked out before exercise. Extreme fatigue and severe muscle wasting. Exercise can help build muscle, it can help reduce fatigue, but if it's extreme, it's really more a combination of exercise, nutrition, proper monitoring, and at that point, really, that's when doctors and physios and rehab programs may help when it's really extreme. Of course, if somebody's dizzy, we don't want them up and jogging. That needs to be resolved first as well. So fatigue is a common thing. Depends on the study you read. It can be anywhere between 40 to 100%. If that's people in the study, there's many different reasons: muscle wasting, hard to eat, many appointments. As you know, you get appointments after appointments and lab work. It's really hard to get exercising, so could be fatigue just from not being active because there's no time. You get medication that affect the sleep, pain, depression, or low red blood cells, which is anemia. So many reasons for being fatigued. So this is just how we try and get our participants, our patients, to get going and try some exercising, setting a routine, and exercising when somebody feels at their best, and then building up from there. If somebody's in pain, getting pain medication is really important, and then coordinating that with exercise. So we usually ask our people to have their pain medications about 20 or 30 minutes before we go in and exercise with them. And of course, if somebody's really too fatigued, we need to balance what they want to do and the exercise, and so they can do what they want and try to build it up slowly. lymphedema, and if anybody that's listening is an expert in lymphedema, I apologize in advance for how brief this section will be. By no means this is extensive, but it's really important to know that the lymphatic system is thin tubes that run throughout our bodies. Their function is to return fluids from the tissues to the blood, filter fluid, and fight infections. And I'm sure there's probably a whole talk or two related to lymphedema. It's chronic swelling of some part of the body because of malfunction of the lymphatic system. It could be related to blockage or removal or radiation. Primary lymphedema, it means that's the primary problem. It's not related to cancer. Secondary lymphedema relates to cancer. Some of the signs and symptoms is arm swelling, the watches or ring may feel tight, arm heaviness, pins and needle sensations in the arm. The best treatment for lymphedema is to try not to get it. And there's ways to reducing the risk, trying to avoid infections, making sure you don't get needles or blood pressure done on the side that had breast surgery, if that's a problem, the type of cancer you had. If somebody had both sides, bilateral mastectomies on both sides, they still need to do that. So usually they'll take the side that had less extensive surgery for their measurements. Avoiding extreme temperatures, for example, hot tubs, is something we don't recommend. Protecting the skin from mosquitoes, stuff like that. Healthy diet and exercise. There is good evidence to show that people with lymphedema can exercise safely. Exercise will not increase lymphedema if done properly. Using the wraps or sleeves is fine, and nothing wrong with that. Nothing wrong to exercise without them as well, as long as it's stable. And the verdict is really out still, which is better, with the sleeve or without the sleeve. My opinion is you need to do what's right for you. So I had people exercise with the sleeve even though they had no lymphedema, and that's fine. Nothing's wrong with that. And I had people who had a bit of lymphedema and they didn't feel they could really exercise without the sleeve. So what we do is we monitor before and after the exercise to see what the exercise does. And really we didn't find that exercise increased for any of our people lymphedema. There's some evidence to show those who exercise it can reduce a bit the lymphedema as well. A bit more about different treatments for lymphedema. There's evidence to different degrees for all of those things. The key really is for the strength exercises to start slow, controlled, and pay attention to the arm. If somebody does exercise and they notice increased swelling after that, so for sure they may need the sleeve. But really keeping an eye before and after. This is probably one of the most common questions I get is this a good pain or a bad pain? So what should I do now? So it's really important to know the difference of that. We can't always tell the difference between them without some extra imaging, but there are some general guidelines that I think hopefully will be helpful for you. The key is really, if you're not sure, ask. Get information. If you're worried about it, if you're stressed about it, it doesn't matter if there's a good reason for that pain, and even if it's most likely not cancer-related pain, that's what we're here for. These are just some of the comments we got from our participants. But really, unfortunately, the worry will always be there. There is no good advice I can give to not worry, but we need to know the difference. I meant before I get to the survival, so I'll talk a bit more about the pain. So how do you know the difference? So for example, if there was you're out shoveling the snow, which at least where I live, luckily we didn't have much, snow, so that was really great. But, if you shovel the snow and then you're sore after, most likely it's related to shoveling snow or gardening or whatever. If it's a new pain, a lot of pain at night, the pain medications that you have just aren't helping, then it doesn't mean it's cancer pain, but it's worth getting checked out. If there's new symptoms, for example, bowel and bladder changes, problems controlling that, or new weakness in the leg and some back pain, then it's really, really important to go check it out. And what often I say to the participants in the different talks I do, if somebody has new back pain and new weakness in the legs, bowel, it may or may not have bowel and bladder problems, go straight to the emerge to be checked out. That's really important. Now, these are where, again, it's important to know these are statistics and studies, and nothing's guaranteed, but there are good quality studies that show that women with breast cancer who exercise during and after cancer treatment are more likely to live longer and have less cancer recurrence. And in this one study published in just last year, they followed just under 5,000 women with stage 1 to 3 of breast cancer for 4 years, and they found higher survival rates in those women who exercised. And the common exercise there was walking at a moderate level for 1 hour a day, so a few times a week. So really, again, it's a bit more than just going around the corner or around the block. Now, it's important to know that everybody's different, and if somebody's really not fit, they may reach their target heart rate that I mentioned before, or their heart rate max, just by going around the block. So for them, that's exercise. That's where everybody's unique, and it's important that you know what you have and you get advice if you're not sure. In a different study in 2011, again, they followed just over 4,500 women, all stages, for 6 years, and they found less risk for cancer-related deaths in women who exercise 3 or more hours a week for brisk walking, and it also applied to those people who didn't exercise before the cancer diagnosis. And it's not only breast cancer. It's if you look at the different titles here, it's people with other cancers as well. So, again, exercise is not a magic bullet. Chemotherapy is important, radiation, surgery, they're all important. But I think, and I'm a little biased because that's what I work with, but exercise has its role as well. And again, this is really general guidelines, general ideas. Everybody's different. If somebody has cancer that's spread to bones, they need specific exercise modifications. If somebody has lymphedema, they need that monitored as well. If somebody's really, really fatigued and weak, important to start slow and build up. That's where physiotherapists or some other health professionals can help as well. Those who know about exercise and cancer together, where they can help. So usually in my talks, this is where I make all of you now stand up and exercise for a bit. But since I can't monitor you, I won't make you do that. But this is just an example of an exercise program, a short warm-up, just to get the body going, circulation going, doing whatever exercise you decide to do, if it's walking, climbing stairs, riding a bike, bouncing on a ball, if that's okay for you, really whatever works for you, as long as it's somewhat fun. These are just examples of simple exercises, again, that you can do while watching TV, just getting the body working a little bit if you're not sure what they are. Most of them pictures are available on the net, and maybe I could talk to Jen, we can post them. The reason I don't like giving the pictures out is if somebody has a specific problem, they need a specific treatment. So this is just an idea of exercises that could be done, but everybody needs their own unique exercises. any exercise program should have aerobic exercise component, 2 to 7 days, as I mentioned, stretching and strength exercise, and of course a cool down. So where do you go from here? For some people, the right thing is to exercise at home. They don't want to go out in the community, and that's fine as long as they know how to do things. And many people know how to exercise, so they don't really need guidance, and that's fine. As long as you know what you have, exercise in a gym. It could be exercise in a physio clinic. I mentioned Canwell. It was mentioned earlier. That's a supervised exercise program that we run in Hamilton, which is great for people from Hamilton. If you're in a different province, it's kind of a long commute. But really, wherever you are, there's usually resources around. We have Wellwood, which is a support group in Hamilton, or Wellspring throughout the Greater Toronto area. So there's different options. I can't really list everything out there in Canada, but would be nice if I could, and that's something that I know some physiotherapists are actually working on creating this type of list. So hopefully there will be at some point a list of all the different programs throughout Canada. And that's the questions. Jen, I'll let you talk. There's a question in the chat here. Does the exercise...
Hi, Oren. Sorry, you just cut out there for a minute.
Yeah. I'll just answer the question that I have here in the chat thing. Does the references for the counts shows how the exercise improves this counts? Unfortunately not. It doesn't. And how they decided on the correct numbers, they probably had good reasons, but again, that's actually not mentioned as good as possible in that reference as well. So there are evidence to show how the exercise can improve the counts, but I don't have that included in this presentation, and it's not that one that's mentioned. Okay, it's all yours, Jen.
You don't have any other questions in your chat?
Nope.
Okay, so at this time I'm going to unmute the lines, and if you do have a question, either you can just, where it says type your chat message here, just simply say, I have a question, and then I'll call your name in order, or you can actually type your question into that box where it says type your chat message here. So just give me one moment, and I'll unmute the lines, and then we'll start taking questions.
Participant lines unmuted.
So I'll just give everyone a moment here too. I know there was a lot of information, and Oren, we're glad that you'll be making these slides available then, because it is nice to go back and review, especially some of the evidence and some of the numbers that you were able to provide everyone with. So if anyone does have a... Pardon me?
Do we send the quiz out to everybody now?
That's right. We forgot to tell you at the beginning. Does anyone have...
I have a question.
Go.
It's Pat in White Rock.
Hi, Pat. Go ahead.
With exercise, a lot of the facilities you go to are quite costly. Is there some way to have this be a lever to facilitate the health services to cover that kind of program while you're undergoing treatment or preventing a recurrence?
Very, very, very good question. Hopefully everybody heard it. The question is, all these exercise programs and many facilities cost a lot of money. Unfortunately, exercise for people with cancer didn't get the same, thumbs up as cardiac rehab. So, for example, if somebody has a heart attack, many places they can go for cardiac rehab. Some places it's still covered under the health plan. Some places there is a fee. I know our exercise program is based at the YMCA. They do offer financial assistance. Private gyms may or may not offer assistance. I know for some of our participants, and it's a growing number, the insurance companies are paying for the membership, because there is a lot of evidence on the benefits of exercise, and many of our participants go back to work, and they feel it's because of the exercises. So the insurance companies for some of our participants have paid the fees. So I know some
So
of our
further on that, then maybe as a policy item, it would be useful to provide that to places like the sort of working groups or committees of the health authorities, as well as we have different health foundations, hospital foundations, and they could perhaps organize bursaries, because it is roughly $800 a month in addition to whatever meds and vitamins and everything else you're doing, to go to a rec center in Surrey for a year, because you have to commit to a year, and go, whether it's the weight room or the treadmills or anything, it just adds up, because for my cancer treatments, about $20,000 in debt now as a result of it all.
Yeah. Unfortunately, you're not the only one that I heard that from.
So I'm just saying that how do we get your information to those kinds of funding authorities to influence some kind of package?
I'm happy to talk to anybody. Like I said, I'm the chair, or it was mentioned earlier, I'm the chair of the oncology group for the Canadian Physiotherapy Association, and we have physios in every province, members of our group. If you want physios to come and present to somebody, I'm sure we can find somebody to help. My life goal is that when the doctors prescribe chemotherapy, the first two lines, they need to be chemotherapy, but I think the third or fourth line should be exercise, because the evidence is out there. And, it would be nice if everything was covered. I don't think until the economy really changes. I know our hospital is always in the red lately. I'd love them to cover that, and I've been trying for the last probably 6-7 years to have something like that available for free. One of the challenges with free is I don't necessarily believe in that 100%, because people, if they pay for it, they use it. If they don't use it. So, for example, in our program, some people pay $5 a month. So most people can handle that. Some people can't, but most can. So, I'd say invite us. You have my contact information. If you're going to lobby and you need some information, we can probably try and pair you up with somebody to try and do that, because it would be nice if there was more awareness, if there was, in the newspapers, there's a lot of lose weight, quit smoking, but not a lot of exercise for people with cancer, which a lot of the evidence is probably just as strong, if not better. So,
okay, I will email you. Thank you very much.
Gladly. You started me on a roll. I can go on that for another hour.
Are there any other questions for Oren? And you will notice that his contact information is on the screen, so if you do think of something at a later date that you had a question in regards to this presentation, feel free to email him.
Yeah, just, I guess, one comment. I can't really give specific exercise prescriptions, because I can't see you physically unless you work and live in Hamilton, I guess, and we can try and meet. But generally speaking, I can't. I've had people email me saying I have this and this and this. I can't really give individualized prescriptions, just making sure that people are safe. So.
Oren, if someone was looking for, let's say, a physiotherapist in their area, what's the best way, and I'm sure there would be some information provided through the cancer centers, is there another way, you spoke of, the association that you work with, is there another way to source physiotherapists in, this sort of a list across Canada?
Each province has its own physiotherapy subgroup. So, for example, in Ontario, we have the Ontario Physiotherapy Association, but each province has one, and they have a listing of all their physios. But that doesn't mean they have experience with people with cancer. I have had people email me directly, and then I send this request for a physio in a specific area. If I have hundreds of people emailing me, then that probably won't work too well, but at this point that wasn't the problem. So if anybody's listening and if they know of somebody and they can't find a physio who can work in their area, they can, again, email me, and I send it out to our membership. At this point, I have asked if our members want to be rostered on our webpage, and I guess just like any other question on the email, I didn't get any answers. So at some point, I may decide, because in addition to being the chair, I'm also the webmaster and a few other duties, but we may create a way where people can log on and put their own information if they want to. So if anybody's listening and they can't find a physio in their area that has expertise working with people with cancer, so then again, at this point, I'll be the gatekeeper.
Wonderful. Well, thank you. Is there any other questions before we wrap up this session? I'm going to take that as a no. Well, Oren, on behalf of CBCN and everyone who participated this evening, and for those who are going to be able to listen after, I would like to thank you for joining us today and sharing your knowledge with us. And there is actually, sorry, before we leave, just a comment that came in from Pat, and she said inspirehealth.ca has a whole person view on cancer with physio contacts and exercise specialists in British Columbia. Dr. Rogers prize awarded to continue good work. So it looks like there is a resource in British Columbia set up. So for those of you who missed that, it's inspirehealth.ca if you're from the British Columbia area. So Oren, thank you again so much for joining us and for sharing this information with us. I will send out the slide presentation tomorrow, and we'll also send it a link where everyone will be able to access this webinar if you'd like to review